Hi, my name is Olivia Anderson. I'm an FMP student at Gonzaga University, and I've been a nurse for 5 years. I would like to bring a national health concern to your attention, and that is the lack of palliative care providers and providers who have training in end-of-life care. Death is not something we like to think about, but it's a fact that we all must face at one time or another. When we do think about dying, most of us want what is referred to by many authors as a good death, a death with dignity, peace, compassion, and comfort. Unfortunately, neither our current healthcare system nor our culture is prepared to make that happen. It is our public health duty as healthcare professionals and lawmakers to facilitate good quality of life, and, when the time comes, good quality of death. Palliative medicine is aimed at relieving stress and suffering and improving quality of life. An Institute of Medicine report on dying in America states, palliative care is associated with a higher quality of life, including better understanding and communication, access to home care, emotional and spiritual support, well-being and dignity, care at time of death, and lighter symptom burden. Today, millions of Americans are living with serious illness, and this number is expected to more than double over the next 25 years. Over the next 25 to 40 years, hundreds of thousands of baby boomers in the U.S. will die. This is why the Palliative Care Education Act is crucial to improve the quality of care and ultimately quality of life for patients across the nation. The objectives of this policy are to support the training of clinicians in palliative care skills, develop and disseminate palliative care curricula, and support continuing education for providers in palliative care. All of us want and need holistic, compassionate care at the end of our lives. But this type of care will not be widely available unless we understand it and demand it now. This is why we need a policy supporting the education and training of palliative care providers. By producing a competent workforce, the U.S. will have the healthcare systems in place to enable good deaths to happen on a regular basis. It is time to transform care at the end of life, and to truly do so, palliative care needs to extend beyond the hospital and into the community. We must insist that insurance companies and Medicare cover palliative care services. If things are going to change for us and for our children, it is time to launch a movement that supports access to quality health care. By supporting the Palliative Care Education Act, we have the power to make holistic palliative care the norm and not the exception.